Um, for folks who don't know, John Fitterer and Nadine Sinchara are MACDC staff, and they're on tech for today. So if you have any tech problems, please feel free to chat them or let them know. I'm really excited to talk about the topic that we have today. So we're going to be talking today about how CDCs are responding to COVID-19 in their communities. And for folks who I don't know, my name is Alana Bruchlin. I'm the program director for health equity at the Massachusetts Association of Community Development Corporations, or MACDC. I'm just going to be giving a little bit of an overview of our presentations today and also of Massachusetts CDC's response. And then we'll have our other speakers will be going into more detail about the work that they're doing in their communities. So I already had a chance to introduce myself. My name again is Alana Bruchlin. When I'm done speaking, then Rafael Maris will be talking about disease mitigation in Chelsea. Rafael works as the executive director at the Neighborhood Developers. Then we'll have Angie Liu from Asian CDC, the executive director, talking about Asian CDC's response to anti-Asian discrimination and also partnerships in creating the Asian Community Emergency Relief Fund. And then last, we're going to have Frank Carvalho, the former executive director, current consultant at Mill Cities Community Investments, talk about the ways in which the business coalition that they had in place in Lawrence from a previous crisis, how they were able to make use of this coalition in order to leverage support for small businesses that didn't have access to PPP or to capital. So before I go into some of the ways that CDCs have responded in their communities, I think it's important to frame this discussion around a theme that I think that you're going to see emerge repeatedly throughout all the presentations. And that's that the reason that CDCs in Massachusetts have been able to respond in the ways that they have is because CDCs in Massachusetts are centered in their communities. Through years and in many cases, decades of work in their communities, CDCs have built the relationships that are necessary to quickly assess the needs among their residents and to pivot their work to respond to the needs of the moment, in this case, to COVID-19. And I think it's also important to note that CDCs in Massachusetts are very diverse. So some CDCs are neighborhood-based, some are regional, some are big, some are small. And just as Massachusetts CDCs have different niches, Massachusetts CDCs respond to COVID-19 in different ways. So our presenters are going to be talking about how they've responded to COVID-19 in the context of their communities. But I think it's also important to note how Massachusetts CDCs as a whole responded to COVID-19. So this graph shows responses to a survey that we sent out in July, which 47 of our members responded to. And during the first couple months of the pandemic, we had lots of anecdotal observations from conversations with our members and from seeing what folks were doing. And one anecdotal observation was that many of our members engaged in food distribution efforts. And that was noteworthy because that was a surprise for many of us. We didn't know that that was an area that our members were looking to be involved in, and I think many weren't, but they saw a need in light of COVID-19 to get food out to their community members. And that anecdotal observation was supported when we sent out the survey. We got the survey response indicating that 2/3 of respondents reported providing food assistance in their communities. We also learned that more than half of CDCs reported working with community members to secure assistance to cover rent or mortgage payments, and also that over half helped small businesses to obtain financial assistance and other support. In addition to the responses to economic challenges in their communities, we learned that many MACDC members stepped up to help to mitigate disease spread, either for those who are property owners in their properties or in their community at large. Half of respondents indicated that they partnered with public health organizations, and close to 1/3 of respondents indicated that they connected residents to COVID-19 testing. And close to 1/4 of respondents said that they provided PPE to community residents. So, and beyond the efforts to mitigate the physical health concerns and the economic health concerns, many CDCs also engaged in efforts to reduce potential negative mental health impacts of social isolation, excuse me. 18 out of 47 survey respondents reported that they connected residents to mental health resources in response to COVID-19. So before turning it over to our presenters, I'm going to talk a bit about a few examples of what other CDCs have been doing. But before that, I did want to talk a little bit about the ways that MACDC has been able to support our network and our members as a whole. MACDC has peer groups that are going, and they're a way for members to engage in meaningful peer-to-peer learning as it relates to their day-to-day work. And in response to COVID-19, we've taken our peer groups to a whole new level, and our groups have been meeting more frequently and have had higher attendance. And we think that this is because our members are craving support around these new challenges that they're encountering during this unprecedented time. And this is an opportunity for members to connect with one another, to share challenges, to ask questions. It's also, of course, possible that our increased attendance has been because people don't have to fight traffic and they can just click on their Zoom. Many reasons why, but we have had a lot more folks attending these meetings, which has been really great. In addition to these group conversations, MACDC staff have reached out to all of our members individually during March and April to check in and see how MACDC could support them in the context of the pandemic. These conversations surfaced needs, which led to further opportunities for peer-to-peer learning. For example, after hearing that folks were experiencing challenges related to immigrant communities in particular, and the challenges that they were experiencing in response to the pandemic, we organized a group to share these challenges and to hear from experts in this area. We've also been fiercely advocating for a policy agenda that includes funding for small businesses, rent relief, and other policies that allow our members to best support the communities in which they work. Last April, we had our first virtual lobby day. We have had many in-person lobby days. And in our virtual lobby day, we gathered Massachusetts CDCs to learn about our policy agenda, to discuss it, and then to in turn have virtual meetings with their legislators throughout the day. We've also been able to communicate with our members through member newsletters and member meetings. We also have gathered resources from opportunities for funding to testing site locations to how to reopen offices safely. And these resources exist on a special page of MACDC's website. We've also taken an active role in the leadership of the Massachusetts Public Health Association's Task Force on Coronavirus and Equity. The Massachusetts Public Health Association, or MPHA, is an advocacy group, and they're a key partner in our work generally. In March of 2019, they formed this task force to advocate for equity in the state's response to the COVID-19 crisis and to rapidly develop policy recommendations. Through this coalition, we've been able to advance policy recommendations that have been supported by over 100 other organizations. Angie, Raphael, and Frank are going to go into detail about the work that they've been engaged in response to COVID-19. And I want to take just a couple minutes to show just a few, highlight just a few quick other examples. Revitalize CDC in Springfield has been distributing food and cleaning supplies to their residents. Madison Park Development Corporation held a virtual job fair during COVID-19. The North Shore Community Development Corporation had a community art exhibit. Groundwork Lawrence has a contract with local restaurants, all of which who are facing economic hardships, to launch an innovative relief response to COVID-19. That both provides much needed meals for their community and also directing critical dollars to local businesses and supporting local jobs. Housing Assistance Corporation established a Cape Cod COVID-19 Workforce Housing Relief Fund. And Watch CDC, which is in Waltham, advocated successfully for the Waltham City Council to use $150,000 for rental assistance. So I opened by saying that our members have been able to do this work because of their deep engagement and connection to their communities that existed before this crisis. I also believe that the initiatives that Massachusetts CDCs are engaged in and the partnerships that have formed are going to outlast the COVID-19 pandemic and further cement the integration between community development and health-related work and its impacts. So I'm going to turn it over to our presenters, and then we'll have some time at the end for questions for everybody, and also for any folks who are here to add any of the work that's been going on in your communities. So I will turn it over to Raphael.
Thank you, Alana. Thank you for that introduction. And thank you everyone for being here today. If you don't mind going to the second slide, Alana, one before that. Other direction. Oh. Thank you. I'm Raphael Maris. I'm the Executive Director of the Neighborhood Developers, and we're a CDC in Chelsea and Revere, and we're also active in Everett. One more. Thank you. We have, our communities unfortunately have been really hit hard by COVID-19. As you've probably heard in the news, Chelsea has been in the unfortunate position of being the community with the largest number of COVID-19 cases per 1,000 residents from the beginning, really. Higher, as you can see, than all other communities in the Commonwealth and many communities nationally, including neighborhoods in New York City. And our other two communities have also been hit very hard by COVID-19. All of them are immigrant gateway communities of color. And so we asked ourselves at some point why that is happening. If you don't mind moving to the second slide. So for years, the regional housing crisis has put undue pressure on our communities. We've seen increased rents and home prices, forcing many tenants to sublease apartments together, double up, live in unfinished basements, share kitchens, bathrooms, and that has, that has always been a challenge, and we've for a long time worked on and making sure that people don't get displaced from our community. And this is sort of the informal way that people have been coping with the increased rents and with displacement, because there isn't enough subsidized or affordable housing in our communities despite our best efforts. As I mentioned, all of our communities are communities of color. They're in the top 6 cities with the highest crowding. And nearly 10% of Chelsea's residents live in circumstances that are considered crowded. And by comparison, in Somerville and Cambridge, about 2% of people live in those conditions. And that has put people in a heightened risk for contracting COVID-19, as you can imagine. So what we've considered, unhealthy and unjust living situations during pre-pandemic times has really turned deadly during these times. So what's our experience? Next slide, please. So while the infection rate in Chelsea has been 92 per 1,000 residents, in our 968 apartments in Chelsea, we've seen a total of 12 cases. And in Revere, we have seen 2 cases total. And I was worried about talking about our numbers in the beginning because I didn't want to jinx it. But the infection rates in our buildings are about 5 to 7 times lower than in the surrounding community. And we attribute that to the fact that our housing is affordable, so there's no need for doubling up. And that, as you all know, subsidized housing is tightly regulated, so both the tenants and the landlords have an interest in making sure that the right number of people live in each apartment. And so it strikes us that while we always have talked about health and housing being so tightly connected and the social determinants of health, that there's never been a time where that has been more immediate than now, and there's never been a time where that has sort of proven what we've been saying for a long time. So that's why we released these numbers. I don't think these numbers are unique to T&D. It might be unique in the sense that the numbers are really high in our communities, in the surrounding communities. But checking in with other CDCs, we found that they also saw a gap. And I would, if somebody conducted a study, I would assume that we would find across the country that subsidized housing is a much safer place and much healthier place for people to live, which you know, reinforces our argument that we need to invest more in affordable housing than we have before. So I think that's it. If there's one more slide for me. Yep, that's it. Thank you, Alana.
Thanks, Raphael. And I think Angie, whenever you're ready. Oh, I think I need to stop sharing my screen and then.
Okay, I'll go ahead and share my screen. Let's see. Whoops, that's not. Sorry, I'm having some problems. Alana, do you still have my slides?
Angie, this is John. If you hit the F5 button on your keyboard,
Yeah,
it'll go into
okay.
presentation.
I wasn't sure if I start sharing. Okay,
Yeah,
can everyone see now?
There you go. Now you're in
Okay,
presentation mode.
great. All right, thank you. So I'm going to talk about two things today that ACDC has been involved in since March. The first one is the creation of the Asian Community Emergency Relief Fund. So in March, very shortly at the beginning of the state shutdown, we started to talk with several other area Asian American serving organizations about setting up a relief fund specifically for the Asian community in the greater Boston area. These are all the organizations that eventually joined hands together, and ACDC served as the administrator of the fund. In total, we raised about $350,000 and have distributed pretty much all of that by the end of August. The fundraising was primarily done through crowdfunding online, as well as seed funding from some foundations. And we wanted to set up this fund to focus not just on Asian families in the area, but we wanted to focus especially on people who might not have been eligible for other benefits, for example, the stimulus funds and unemployment, because we knew that there were probably many people within our community who were undocumented. We set up 4 intake phone lines in Mandarin, Cantonese, Vietnamese, and Khmer. And so whenever applicants called in, we would ask a series of questions to do some initial screening. If it turns out that they were actually eligible for some other benefits like SSI or food stamps, we would then refer them to those and help them apply for those. And then for the remaining families, we would approve them for gift cards. Next slide. Oh, sorry, that's me. Okay, so here you can see a little bit of the approval breakdown of where, what types of households the assistance went to. So you can see about half of the funds went to undocumented households. This was something that we kind of knew about our community, but because ACDC, we actually had not previously focused on working with undocumented families. And I think when people think about undocumented immigrants in this country, people tend to think about Latinx community, whereas the undocumented issue within the Asian community is kind of hidden. And but this has told us that there are indeed lots of undocumented households within the Asian community. The remainder of people who received assistance, as you could see, they were ineligible for other benefits for a variety of reasons. Some was because they have been working and getting paid in cash, others because of their immigration status and did not have work permits, and still others were self-employed. So I highlighted 2 examples of the profiles of families who had received assistance. One was a Chinese applicant who worked as a home health care aide. Her husband worked as a housekeeper, and they had trouble applying for unemployment because they haven't paid in cash and were considered self-employed. The other was a Vietnamese family with only 1 adult working at the time of application. 3 adults had recently immigrated to the Boston area from Vietnam, and they were afraid of applying for food stamps because fear that this could jeopardize their immigration status. Okay, so here are some of the lessons learned, and not just for ACDC, but I think for all of the organizations involved in the Relief Fund. So what we found was that for many of the applicants who called in to the intake lines, this was the very first time they had heard about possible governmental resources that they could be eligible for. So putting aside a relief fund, many of them did not even know about things like food stamps, SSI, and other state benefits. And I think for many of them, especially the ones as you move further away from greater Boston, many of them, this was also the first time they had been in touch with a community organization. And I think that one of the biggest challenges for them was actually language access. With limited English proficiency, they did not know about many of these public resources. The second one, we had a hunch this was happening in Massachusetts, although I think early on in the pandemic, we heard a lot more about hate crimes and hate speech against Asian Americans in New York and on the West Coast. And we knew that this was certainly happening in Massachusetts, that we were not immune to this. And so during the initial phone intake staff did make sure to ask questions about any sort of hate crime, harassment that the people experienced. And this was certainly the case. The third is that the public charge rule, especially espoused by the Trump administration, has been a huge barrier in our community getting the resources and help that they need. Many of the applicants we spoke to, on paper, they were eligible to certain public benefits. However, they were so fearful by the anti-immigration rhetoric, and they did not want this to jeopardize their immigration status, that they were very reluctant to apply for any benefits, including our relief fund. The last one is that from the get-go, we knew in setting up this relief fund that this was a stopgap measure. And the gift cards that we were giving out were not going to be a long-term solution, and that it was not going to be enough money for many of these households who had often multiple generations living in them. And many of them now also had college students who had moved back home. So some policy implications, some of these are more state and local, while others are more federal. One that we learned early on was the unemployment benefits were not accessible in an equitable way. Language access was definitely a huge problem. As we all know, the State Department of Unemployment Assistance quickly moved to this online portal, which was available in English and then I believe Spanish. However, if you spoke any of the other languages, you really had trouble applying for unemployment benefits. So our organizations had to provide a lot more staff time and assistance to folks to apply for unemployment. The second one has to do with standing up against hate crimes and hate speech. Early on in this pandemic, Trump came out and called this the China virus, Wuhan virus, and we have seen immediate ripple effects of that. And we really need all the elected officials to unequivocally stand against hate crime, to document it, as well as to prosecute these hate crimes. The third, this is really federal policy, and it's really about the ongoing impact of the public charge rule. Like I said before, many people who were eligible for benefits didn't want to apply because of fear about the public charge rule. The last one is about enforcing worker protections. The people who we serve, especially through this relief fund, most of them work in very low wage jobs and have limited English proficiency. Employers, even in asking them to return to work, did not always provide appropriate PPE and protections. And so these workers are especially vulnerable, and people really should not have to choose between their health and their jobs. So now I'm going to pivot to the next one, which is another campaign that we have been involved with for the last several months, and it's called We Love Boston Chinatown. So this campaign, you may have seen similar efforts in New York's Chinatown. So Chinatown, I would say during the pandemic, started suffering economically from the pandemic earlier than many neighborhoods, as early as January and February. And unfortunately, a few businesses have already shuttered, and those remaining are really struggling to hang on. We know that programs like the PPP loans have been unfortunately limited assistance to them. And one thing I'll just mention is that in Chinatown, the small businesses and the residents are very connected, because the small businesses, they really provide critical jobs for the residents, and the businesses are part of what makes Chinatown vibrant and unique. And so this campaign has 4 messages. Number 1, we are open for business. After the initial lockdown restrictions have eased, places are open, and we want people to come here and shop and spend their dollars. But to the second point, we want people to do that in a safe way. So adhering to social distancing and wearing masks. Number 3 is to counter against anti-Asian xenophobia and racism. So we've come up with this slogan, racism is a virus. And the last one is to try to do this in a fun and positive way to celebrate Chinatown's history and culture. So here, the organizations got together and was able to pull together some money and to hire a professional graphic designer to put together these graphics. So these have been printed, and many restaurants in Chinatown post them in their windows to get the message out. And so, sorry. Okay, so these are the initiatives specifically to help out the small businesses in Chinatown, most of which are restaurants. So the first one is a more comprehensive website that's actually still in progress, as well as social media campaign to get the word out. We've also helped some restaurants to set up outdoor dining spaces on the street because Chinatown is pretty tight. So depending on a restaurant, outdoor dining space isn't always possible. Takeout Thursday is a big part of the social media campaign. This is to promote people to order takeout at local restaurants. And I know that in September, on certain nice days, the Greenway and the Power Arts Center also had arranged outdoor musical performances to coincide with Takeout Thursdays. Next one, what we heard a lot from the restaurants in setting up outdoor dining was a concern about taking away street parking for potential customers. So we actually had one or two private garage owners who were interested in helping in this effort. So we helped them negotiate some discounted parking for customers who are coming in to Chinatown to encourage people who were driving in and had that need. And lastly, that's something that is still in the works right now, is to have a much more widespread campaign to get gift cards from the various businesses and distribute them to encourage spending in the businesses. So that's it for my part.
Great. Thank you so much, Angie. Really learned a lot from that presentation, and I love hearing about, as you described, the connections between the residents and the business community and how those are really inextricable in your community. So we're going to turn it over to our last speaker, and then we'll open it up for any questions or reactions. So Frank, it's all yours.
Good afternoon, everyone. I don't have the visual that everybody presented, and the story that I'm going to share with you is a little bit different. MCCI, because it's going to be focused more on the business side and the residential side. MCCI, besides being a certified CDC in Massachusetts, it's also recognized, certified by the CDFI fund as a certified community development financial institution. And MCCI is also licensed by the Division of Banks as a mortgage lender in the state of Massachusetts. So the story for MCCI really began, unfortunately or fortunately, depending on how you look at it, we began to learn about how to deal with COVID in 2018. On September 13, 2018, the Columbia Gas had a lot of explosions in the Merrimack Valley, which is our focus area. And 3 towns were deeply affected by that, with most residents being displaced from their homes, and over 900 businesses either temporarily closed or permanently closed. On the residential side, whomever had a mortgage with us, we offered them a forbearance for 3 months. And on the business side, we help bridge the gap through the disbursement of emergency loans, business stabilization grants, rent stabilization grants, and incentivized business-related training. So that really helped us unexpectedly get prepared for COVID. To give you an example, we had in emergency business loans to help stabilize cash flow, we had $387,000 in loans to 15 business with an average loan amount of about $25,000. We also gave 83 business up to 3 grants totaling $334,000 to help them stabilize their working capital. We help a lot of these businesses also with rent stabilization funds. We help 265 business with $1,500,000 in grants distributed. And we also, through that process, learned that most of the very small businesses really could not even prepare a claim against the gas company because they didn't have the necessary paperwork. So we established some trainings, and I'm happy to report that we had 14 bookkeeping trainings, and over 170 businesses graduated from the program. And we also gave them about $108,000 in loans in order to establish bookkeeping uh, capacity. So March 2020 happens. A lot of these businesses are recuperating. They're not back to where they were before the explosions in 2018 and the pandemic hit. So immediately we had worked with a consortium of other nonprofit organizations and the private sector. For example, for the emergency business loans, we brought 20 banks together. So having that resource in place, immediately we call a meeting of all the partners involved, and we decided to take action. A whole bunch of nonprofits were taking care of the residential and MCCI, as we did with the Columbia gas explosions, took the lead in providing services to the small businesses in the area. And the first thing that we noticed was that a lot of our businesses, and 93% of the loans that we make are for Black and minority-owned businesses, they were not having access to the PPP program, mainly because they did not have a banking relationship and the banks were shutting them off. So we called our friends in the state and coalition MACDC. As a member of MACDC, MACDC took the lead in convening over 70 service providers to address the issue. And through that process, we were able, with our structure that we had in place for the gas explosion, we were able to contact 360 small businesses in our area, and 148 of them got approved for PPP loans, for a total of over $2 million in loans being granted. The average loan amount was $13,000. So you can see that we were really dealing with the real small business in our area. Another thing that concerned us was the fact that a lot of these businesses were closed, and the mental health of those business owners was a concern to us. So we decided to create virtual business meetups, both in English and in Spanish. And that brought together a lot of small business owners that really like to be able to have a forum in which they could freely express how things were going, learn from their peers. So we had over 60 business participate on week meetups, and we learned from them firsthand what they were needing, what they needed, and most recently, we created a specific training where we created a few tools to help the businesses assess where they are, help them find out what their break-even point is, and help create a plan to help them deal with the pandemic. And we continue to work with the coalition of technical assistance providers in order to come up with possible solutions, and as well as identify other resources that may be available. We took a look at our business borrowers and also the residential, and we sent a notice to all the residents and said, look, you have a mortgage with us. We have 67 residential loans for $1 million, and we gave them a forbearance of no payments for 3 months. And we did the same, 26 loans, $1.9 million worth of commercial loans. We did the same for our commercial borrowers in order to help them deal with the crisis on hand. Happy to report that all the commercial loans and the residential, some of them, especially on the residential side, did not take the forbearance. They continued to make the payments. And now the commercial loans have resumed making their payments with the understanding that if they run into any issues that they can contact us and we are willing to work with them. This is how MCCI addressed the needs of our business and also the resident community that we service. I'll stop there. I could talk forever.
Thank you so much, Frank. That was really great to learn about the connections between that previous the previous disaster and the current one. I mean, terrible, and also really good that you were able to leverage a lot of lessons from that past experience and relationships and such. So we have about 20 minutes left, and I think maybe I'll open with the first question, and then I would love to hear from other folks, either if you have questions or if you have reflections about your own community. I know that I don't know where everybody is coming in from, and I know that there are some folks who are here from all over the country. So I'd be really interested to hear what in this conversation has seemed familiar and what seemed different about the communities that you're in. But I'm going to just start, and I think many of our speakers touched on this a little bit, but to ask explicitly of our speakers, if you just want to share what you're taking away from this experience that you think that what kind of systems or infrastructure have been put into place that you think that we'll be able to benefit from as we think about one day moving out of this particular moment that we're in and this particular crisis. I know Frank spoke to how you leveraged the last disaster and how that impacted where you are for this one. And now I'm thinking about not necessarily for the next disaster, though that as well, but also, you know, just in terms of our organization's day-to-day operations and how this the infrastructure that we've put into place will be able to continue to benefit from. And that's for any of the speakers who want to chime in.
I think I'll start it. One of the big lessons learned both times is that we need to continue to focus on the educational part of helping small businesses understand the importance of record keeping, of relationships, because that's something that they are not trained to do. Most small businesses, especially ethnic businesses and Black and Brown, they are excellent at what they do. They're excellent at their trade, and they know their communities, but they really don't have any formal training. So what we learned through these two processes that we have going through is that throwing money at the problem does not really solve the problem. We need to create an environment. We need to create a way where we help our communities to really create wealth, and the wealth comes in the form of access to capital, acquiring assets, but also acquiring knowledge. And acquiring the knowledge may be one of the areas that unfortunately, because of circumstances beyond our control, and as a first generation immigrant, I am saying that I have had the opportunities to go to school, to learn, and to acquire assets. But along the way, I had to really overcome many discrimination practices that were barriers for me, and I had to remove them. So we need to realize that that is something that happens in people's everyday life, and we cannot just put it on the side or brush it on the side. We need to deal with it, and so other peoples have the opportunity to really participate in our democracy.
I think at T&D we have, in addition, we've responded, to the deep economic need in our communities in the beginning by starting a hotline where people can call us, similar to what Asian CDC has done, where people can call us and ask for help in applying for various public benefits, unemployment insurance, SNAP. We turned our tax preparation VITA program into a virtual program, which wasn't an easy thing to do because we needed federal approval for that. And now raft rental assistance. And I think that's here to stay for us. We feel that we've sort of helped people in that area previously as part of our financial mobility work, economic mobility work, but we learned that by being this available to people and by sort of broadening the areas in which we help, that we can have a huge impact. And so I'm pretty sure that that structure is something that we're going to retain post-pandemic. I would also say that if somebody had told me at the beginning of March that we should move our whole operation virtual and then do more work than we did before, that I would have told everybody that's impossible, we can't do that. And then what happened is we were forced to go 100% virtual and work harder than we already did before. And our team really rose to the occasion in ways that is just, inspires awe. People are really passionate about their communities, and they're really passionate about the need to respond to the challenges that came out of this pandemic. So I'm curious to see what will happen, but we've really been able to work from at home in ways that are in some ways more efficient than working from the office. So I think there'll be a lot more flexibility in the future, even after the pandemic is over at our office. And then I think finally, I would say that collaboration is something that we've always prided ourselves in, but this pandemic has brought us a lot closer with others in our communities. And we have built deeper relationships with other community organizations and community leaders, and have been engaged with new ones. And I think it will ultimately make us stronger as a community because we've learned to work together under these difficult circumstances.
Sure, I agree with Raphael. I would say a lot of the work that we didn't used to do, but now we're doing are probably here to stay for at least for a while. The other thing that I would say is that because of the relief fund, we've gotten to know many people, even applicants who we ended up not being able to help, but now we have some basic contact information. And now we are a new resource of potential assistance for them, so that we now have a much bigger pool of people in the community who we know to reach out to. So over the last couple of months, one thing I didn't mention was we were also on the intake phone lines doing census outreach as an aside whenever people called us. Because knowing that many of these folks who were calling in were probably some of the hardest to reach population for things like the census.
Okay. So we have a question from Ruth in the chat of how different organizations, including MACDC, have been able to support employees. I could answer very briefly for MACDC, and then if any of our folks who were on the the panel want to chime in. And also just to say, if folks want to feel free to put questions in the chat, or feel free to unmute yourself when we're done answering this question. We can make this relatively casual, and also feel free to like I said, share any experiences from your community. So MACDC has been extremely supportive, I would say, of its staff. We only have 11 of us, so it's a pretty small place. Luckily, we did not have to make any sort of layoffs or anything like that. So so unemployment and government benefits, as far as I know, did not have to be a thing for MACDC. From a digital perspective, we were really in good shape. Prior to the pandemic, we did not work remotely, but we were relatively well set up to work remotely. We just brought our laptops home, and all of our files are on the cloud, and all of our phones were already able to go to our cell phones if we connected them and such. So that was definitely, I think, a lesson that we learned. And thanks to our Director of Operations, John, who's on the call, who really upgraded or encouraged us to upgrade our systems, not clearly anticipating the pandemic. But I'd say in general in MACDC, you know, our leadership has been just extremely open to folks' individual needs in the context of knowing that this is just a hard time for everybody in a lot of different ways. Anybody, Angie?
I'll jump in. For MCCI, we a small group, 7 of us, and we were able to convert our classrooms and everything virtually very easy. I think the most difficult part was putting together a policy, because we did not have one. We never expected to need one. So that was the most difficult part, and it took about a month in order to get it together and approved by the board. But it is one that does support the employees, and it does create some level of expectations on what their conduct working from home should be in order to remain efficient for the organization.
Yeah, I can just add briefly. I mean, you know, we were forced to go entirely virtual since mid-March. And like MACDC, our staff is fairly small. We have 10 people, and we've been lucky so far this year. We have not had to make any sort of personnel cuts. So that's been great. You know, we do have a couple employees with young children at home. So, you know, I think it's very much flexible and try to be as supportive of our staff as possible. I think what's really hard is probably the sense of isolation. You know, we switched to having weekly staff meeting just so at least we could see one another's faces. And but I think we haven't had enough chance to have, you know, sort of more of the social, non-work, non-business interactions. And I think that's been difficult.
I would just add that we just have provided a lot of flexibility to people. Obviously, everybody's working from at home, but then, you know, working different hours, being able to adjust for childcare. There was actually a real desire to come back to the office for some people, and we came up with a way to do that in a socially distanced way by lowering the capacity of our office significantly. We now only allow 10 people to be in the office together at most at the same time. They have to sign up through a scheduling system beforehand to make sure that there are never more than 10 people there. And quite frankly, we don't hit that. But it really provided relief for some people, a small number of people, to be able to work maybe away from children that interrupt them when they choose to. But you know, I just want to be honest with you, it's a great question. I think we're too small to be able to address some of these issues. I think childcare is obviously a big one. But we're, you know, we're not in a place, obviously, to even consider providing childcare for our employees, let alone our community. It's a huge issue for parents who can't, you know, many have lost their jobs, but there are even ones that could go back to work if only their young kids weren't at home, but rather would go to school in person. And so we've addressed many of the challenges that this pandemic has put on our organization and community, but many we really don't have the opportunity to be able to respond to. Alana, you're on mute.
I have a question, not for the panelists, but for the audience. Do you guys have anything out there that is unique that we could learn from?
Yeah, feel free to just unmute yourself, or you can type in a chat.
In the countryside, we say, I hear crickets out there.
This is a quiet crowd.
Seems like Ilan is having some technical difficulties.
I'll just bring up a point. I'm Sarah Barkin from CDAC. We're quasi-public in Massachusetts, and we work with most of the CDCs and other nonprofits. And when I was listening to Raphael's presentation, but I think it would be true for almost any of your organizations, that those numbers that you show really point out the distinction and the difference between density and overcrowding. And I know in Massachusetts, you know, we have so many difficult conversations and battles over citing affordable housing. And sadly, the pandemic has become, you know, another excuse for expressions we've heard for a long time about why people don't want dense housing in their communities. And but the numbers are just so clear about you know, the health benefits of good, you know, well-managed affordable housing. And that's the density that we want, that, you know, supports healthy communities. And I'm curious whether there have been similar conversations in other parts of the country where, you know, we can see our CDCs as real leaders in providing housing that's, you know, a true health benefit. But still having to fight against those stereotypes and, you know, people using their own frames about racism and pushing back on affordable housing.
Sarah, one of the things that I never understood, and I had my battles with the CLO when I was the head of the CDC in Lowell, is that affordable to whom? Most recently, most of us are building houses for teachers, for people who are firefighters that are not making enough money to afford their more than what their salaries can pay, depending on where they are. And the politicians always have this stereotype of people who live in affordable housing, and they're not dealing with reality. So again, that's where the educational part, and I know the MACDC and all the members fight that battle every day and trying to educate the community out there of elected officials and others, but it seems to fall on deaf ears most of the time.
So we're at 3:59. I apologize to everyone that my Zoom froze at an inopportune time, but I'm back. Did anyone else, I heard only about half of Sarah's question, so I'm not sure if other folks want to respond quickly. No? Okay, great. So thank you everybody so much for coming. Thank you especially to our speakers, to Angie, to Raphael, and to Frank. It was really so great to learn about all the different things going on all over Massachusetts. And I hope that we can continue this conversation. I'm also just putting in the chat, I think folks know you're at the NACIDA National Forum, and through your registration, you have access to a few different sessions, including several national plenaries, but also there's a conference bookshop with a lot of really interesting books. So please do check it out. And I hope that everyone will stay in touch. And thanks again so much for coming. And I hope everyone has a good afternoon.
Thank you.
Thank you.
Thank you, everyone.